Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome back to Bad to the Bones. I'm your host, Debbie Rody. Today's episode is a little different, but incredibly powerful. We're talking about something called empowered relief, an evidence-based approach to pain management that focuses on training the brain and the nervous system, not just treating symptoms. Joining me today is Dr. Mariani from Premier Orthopaedic Associates, who leads this seminar that we're going to be hosting, and she's going to help patients better understand their pain and how to manage it. Dr. Mariani, welcome to the show.
Thank you. Thank you for having me.
I'm looking forward to this conversation. I know this is a seminar that we've been working on delivering to our patients and just the general public. And today you're going to kind of dive in with us and share the benefits, talk a little bit about what the base is of it, and let's get into it.
I'm excited to do that.
Yeah. Yes. So let's start with the basics. Can you explain a little bit about empowered relief to someone who's never heard of it before?
Yes. So Empowered Relief is a 2 hours evidence-based, skill-based class. Mm-hmm. It is designed for patients with chronic pain, but also with acute pain. It's designed by a team at the Stanford University by Dr. Beth Darnall and her team. Mm-hmm. It's actually delivered internationally in 30 countries worldwide. Wow. And translated in 8 languages. So it is utilized widely already. And it provides neuroscience education on pain to patients and equips patients with skills and tools that they can use on a daily basis to handle the pain, trying to, by themselves without the use of medications and without the use of procedures. So that's why it makes it very interesting. And so the gold standard of behavioral therapy nowadays is cognitive behavioral therapy, which is behavioral therapy. It's usually utilized over a couple of months with 8 sessions once a week. Yeah. And there is a study comparing Empowered Relief, which is a condensed 2 hours class with 8 classes of cognitive behavioral therapy. And studies show that Empowered Relief has same efficacy or even better efficacy than cognitive behavioral therapy in only one session, which makes it more scalable and very interesting in that sense.
So what makes it different than other approaches for managing chronic pain?
Yeah, so the difference is that it's only one session versus multiple sessions. Okay. And then it's based on neuroscience and cognitive behavioral therapy, but it's condensed. Yeah. It's like a crash course on coping skills. Mm-hmm. And it focuses not much on removing the source of the pain, but more in decreasing the nervous system amplification of the pain and the catastrophizing cycle, the fear cycle involved in patients when they're in pain. And that makes it very interesting in that sense.
So one of the most interesting concepts about pain is that it's not just physical, that it is processed in the brain. So can you explain a little bit about what that means to patients who they're feeling pain in their body, but we're going to try to tell them that your brain can control that?
Yes. So pain has 2 main components. We have the sensory component, the somatic component, which starts in the periphery of our body through receptors, you know, and when we get injured, that's where the signal starts. It's not pain yet. Mm-hmm. So the signal gets transferred through the nervous system to the spinal cord and to the brain, and that's the sensory part of the pain. Yeah. But the actual experience of pain, it is structure in the brain. That's when it becomes pain. The brain integrates a series of information when we do get hurt. The brain will integrate the signal of pain, the memory of the pain. It compares your current pain with previous experiences of pain. Wow. It integrates the sensory, the emotional part of the pain, the stress, the fear, and also the expectations of pain. Is it ever going to pass? Is it going to get better or worse? So the brain will integrate all those information, and that's considered the experience of pain.
That's so interesting. And that's pretty powerful to know that your brain, it's like a little computer.
Exactly.
That's so powerful.
The brain will amplify the pain or decrease the pain based on how we control it.
Yeah.
Yes.
So how does stress and emotions, anxiety, fear, does any of that influence or amplify what a
Yes.
person is feeling?
Yeah, it definitely does. In fact, when we are in a calm state, if we're calm and relaxed, usually our threshold of pain is higher and we're less sensitive to pain. If we are stressed out, we have a lot of emotions and stress, then usually our threshold decreases and we are more sensitive to pain. And so fear, stress, and these emotions, what they do, they act like a volume knob in the pain. So they activate certain areas of the brain and they make the brain more sensitive to the pain. And
That's a good explanation. I like that.
And also through the release of adrenaline, norepinephrine. So all these neurotransmitters, they will act in certain areas of the brain to amplify the pain when there is stress and fear and anxiety.
So if we talk about why mindset matters in dealing with pain, you talk something about like maybe an unhelpful pain mindset. What does that look like for a patient if their mind is just not helping them? Yeah, it's just going.
Yeah.
What does that?
Yeah, so unhelpful is very common. Unhelpful mindset, it is an interpretation of their reality.
Yeah.
That leads to increased emotional distress and disability, and decreased function. And it can manifest in different ways. For example, an unhelpful mindset, it could be, it's called catastrophizing. And it's, for example, when a patient starts thinking, the pain is never going to go away.
Yeah.
I'm never going to be able to start doing things that I like to do. And this usually leads to increased muscle tension, increased stress, and in increased high blood pressure and high heart rate. And there's another way in which patients have an unhelpful mindset is avoidance cycle. It's the avoidance of movement. So where movement is seen as damaging. So if there's pain, the patients are afraid to damage something. And this is usually not very accurate. Usually pain is not really dangerous.
Yeah.
But very often the patient will stop moving, they will avoid movement. And this is, long term, it can, cause muscle atrophy, stiffness, and decreased sense of control.
So for someone listening who may realize, well, I've had thoughts like that when I'm in pain, that I'm feeling like this is the end of the world, it's never going to go away, and it's just compounding. What is the good news for them about how this program can help, this seminar?
Yeah, so this is a great opportunity to train the brain, and training the brain meaning updating the brain with new experiences.
Yeah.
Brain, if you think about the brain like a muscle, if you want to increase your muscle strength, you have to exercise every day. If you want to lose weight, you have to start a diet. It has to be done on a regular basis.
Yeah.
The same things happen with the brain through certain techniques. You're able to rewire the brain and to be able to have great benefits. So be able to actually modulate your pain and turn the volume down. The pain doesn't go away completely, but you can definitely modulate and decrease it.
So you're basically training the brain away from the pain.
Exactly.
Yeah.
Shifting the attention from the pain.
And what's an example of what that type of practice looks like, training your brain?
So it can be done in different ways. Definitely the main techniques like deep breathing, shifting the attention, focusing on something else. There are some grounding exercises, grounding sensory exercises. For example, when we have a flare-up of pain, you can shift the attention to something that you see, something that you feel, sometimes texture, thinking about or touching certain clothing can shift the attention away. Relaxing the muscles, try to scan for tension and see where the tension is building up and trying to release it. And reframing the unhelpful thoughts that you have through your mind. These are some of the techniques.
So let's get into a little bit of the core skills that people will learn in this seminar. The program teaches 3 main tools, I believe, to help change that channel or turn down the volume in the brain. What is one of the channels that are at the very high level?
Okay, so
or the techniques, the
techniques.
tools.
So there's like you said, 3 of them. One is through relaxation techniques, so deep breathing, The second one is reframing the unhelpful thoughts of pain.
Yeah.
Sometimes, when the patient, during the class, they will receive a plan. They actually have to write down unhelpful thoughts and try to reframe it.
Okay.
And then another way is this binaural audio file that it's given to the patients. And this is very interesting. It's part of the treatment plan. So it is an audio file made to two different frequencies. So there is on one side...
Like hertz frequencies?
Yes,
like
hertz frequencies.
Oh, I love that, yeah.
So on one side you have about 200 hertz, and on the other side 210. The brain cannot perceive the two different frequencies, but only perceives one tone of 10 hertz, and it's called binaural tone. And that tone actually, if the brain is exposed to that tone, it can actually modify the structure of the brain and decrease the pain. So this is part of the treatment plan, and
that's really interesting because I just got influenced on social media to buy tuning forks. Those you bang those forks and they vibrate a frequency. So it's kind of along the same lines. It sounds like that's really interesting. So if we talk about the relaxation part of that and the audio, how does it literally penetrate the body, and how does that work?
Yeah. So as far as the relaxation techniques, just decreasing the breathing rate and relaxing the muscles, it increases the parasympathetic system.
Okay.
And that will cause decreased heart rate, decreased breathing, vasodilation, decrease unhelpful thoughts. So just the sympathetic, there is a balancing of the nervous system just by doing those, utilizing those techniques.
And one of the third ones was the self-soothing actions, like self-talk. How much of that do you think patients try to do already? And how will we teach them in this seminar to kind of make that a habit?
Yeah, I don't think a lot of patients with chronic pain, I don't think they receive this type of education.
Yeah.
There's a lot of need of some type of behavioral therapy, cognitive behavioral therapy, but it's definitely underused.
Yeah.
So I think it's a new experience.
Yeah.
I don't think anybody's educated about changing your mindset. I think it's something that it needs to be done, and that's why this class is very helpful, because it can be delivered in person or even virtually.
Yeah.
And these techniques can be taught. I don't think most of the patients with chronic pain they don't know how to do this.
Yeah.
It has to be taught.
Yeah.
Yes.
Yeah, I think, you would know this from experience, but I think most people in pain, it's just so, it's just all in the body. And, I don't think I've ever thought that, it's in my head, that if I just calm my mind and my thoughts, that I could just
you can modify the intensity. Yes.
Yeah, I'm really excited about this seminar. I think it's going to be really helpful.
I think so. I think it will be very helpful.
So if you're building a personalized plan, that's one of the benefits to this program, right? Is that when a patient comes in, and after we launch the seminar, you can make this part of their plan,
routine.
Correct?
Mm-hmm.
Yeah.
Yeah, absolutely.
And what would that look like? Would that be in conjunction with other techniques, or do you think that this could be the main focus?
I think it should be always in conjunction with other techniques, depending on the type of pain. The studies done on the Empower Relief, they were mainly on chronic pain, but I know there are studies also on postoperative pain. So even in the acute pain, it can be effective. So I think it could be done definitely in conjunction with it should be offered to everybody.
Yeah.
It won't educate themselves about what happens, in their body, in their brain, whenever they experience pain. I think it's very interesting.
Yeah.
Some patients may not need it, but if you find yourself with a flare-up or just dealing with pain, the medication you have available, they're not enough, or it's during the weekend, or you have to wait, you have to be able to do it on your own. I think it will be...
It's like another tool in their toolbox of being able to help themselves.
Exactly.
And I feel like, patients are going to want to have it, but then maybe forget that they have it. And then, I don't know if you've ever heard the saying, 21 days forms a habit.
Yes.
So how long do you think patients or anyone would need to consistently do this to make it a habit and change that. Yeah.
And even and especially to have the outcome, the desired outcomes.
Yeah.
I think the studies that they did, they're recommending at least 3 months.
Okay.
So 3 months where maybe not on a daily basis, but pretty regularly in order to have a good relief and really, decrease the pain level and be able to calm down all those other side effects of pain. So it has to be done regularly for at least 3 months.
Yeah. I mean, that sounds logical when you think about someone with chronic pain. I'm sure they've had chronic pain for more than 3 months.
Yes.
I mean,
usually,
in most cases, right?
Yeah,
so
absolutely.
That seems reasonable. Well, so for someone who feels like, they've tried everything to relieve their pain, how do you think this approach could be introduced so that someone really can believe in it, that it can really help control their thoughts?
Well, I think it comes from, the education, explaining patients that, they have real pain, the pain that they have, it's real, but because it has these two big components, there is the healing of the part of the body injured, but there's also the pain. The brain is the part of the system that decides how loud the pain will be.
Yeah.
So explaining this mechanism, and then explaining that when everything else is failing or it's not enough, they can always patients can always apply these skills. They can really be able to feel better, to be more functional.
Yeah.
Sometimes you can still have pain, but maybe you can avoid all those avoidance cycle, catastrophizing thinking. They can actually make the patient feel stuck, or that they can't do anything. A lot of my patients, they spend all day sitting on a recliner because they're afraid to damage something.
Yeah.
So just by understanding that pain is not equal to danger, and pain is not damaging anything, you can start introducing movement, so all these things, I don't think they're never explained in detail, and they can help to get the patient to function again.
Yeah, I love the part about how people are going to learn the brain-body connection, right? I mean, I just think that's super cool.
Yeah, and I think it can be applied honestly to chronic pain, but also to any other aspects.
I would think like even everyday stress.
People feel
whatever.
stuck for a lot of reasons, not just for pain, and this is specifically done for chronic pain. But I think this mechanism, they can be applied to a lot of other areas of life.
What are you most excited about in delivering this seminar?
I think just providing a new tool and the education part of it, I think a lot of patients will be happy. They will be surprised to learn really what's going on in their mind and in their body with pain, because it's something that, you don't imagine anything like that.
Yeah.
And so that's exciting. And then, that they're able to feel empowered, to have a set of skills that they can utilize at home, and they don't have to rely on medications all the time, or maybe they can decrease the medication they're taking. And so that's the exciting part.
Yeah.
Yes.
Is there anything about the program that we might not have talked about yet that you feel is important to bring into the conversation?
No, I think we covered the main things. Yeah. Everything else will be in the class, I guess.
Yeah, yes. It's really exciting. I mean, this has been a really great conversation.
Will be in the class.
Yeah, and there's going to be a lot of takeaways for people.
I think so.
And, I love the idea that they're going to learn things that they can do at home and always have at their fingertips.
And one thing interesting is that they can also have family members participating to the class, because it's important the family members will understand too what the loved ones is going through, and they can also help reinforcing these concepts.
Oh yeah, that's a really good idea. Well, I think we've covered everything then, right?
I think so.
Yeah, I'm looking forward to getting the seminar up and running and introducing it to our patients and just our listeners. It's been very helpful. I think it really talks a lot about shifting pain mentally into the body and how people can really manage that better. So thank you so much for sharing this.
The opportunity.
Yeah,
absolutely.
It's awesome.
It's exciting.
So Dr. Mariani and Premier Orthopaedic Associates will be offering a 2-hour empowered relief course from a virtual platform quarterly. So please check our website. It's going to be listed under patient resources for upcoming seminars. If you'd like to learn more about empowered relief or you think it might be right for you, visit our website at poasnj.com under Patient Resources, or you could always call us or text us at 856-690-1616. There will be a registration available on our website under the Patient Resources coming soon. So as always, until next time, keep those bones strong and those joints moving, and we look forward to relieving your pain.